Hello everyone, my name is Colby Souza, and this is Failure and Non-Failure Training Groups in a Daily Undulating Periodization Program Strategy and the Effects on Muscular Hypertrophy and Strength. I'll give you a little overview of what we'll be speaking about today. First, I'm going to go over the introduction, then a literature review, speak about the purpose and the hypothesis, talk about the methods, and then wrap it all up with limitations and practical implications. So a little introduction. It is known that muscular adaptations such as hypertrophy, strength, and endurance are influenced by resistance training. And when looking at program design, a periodized training protocol has greater influence on skeletal muscle adaptations than a non-periodized protocol. Session-to-session variations of training variables such as daily undulating periodization produce superior results for hypertrophy and strength compared to linear periodization, which is just variation between each mesocycle. Within a DUP-type program, it's been demonstrated that hypertrophy and strength adaptations are primarily volume-dependent, independent of the repetition range, meaning high repetitions aren't better than hypertrophy and low repetitions are not better for strength. It all depends on the total volume completed. However, despite these findings of Klemp et al., it was not reported how close subjects were to failure on completion of each set. Muscular failure can be defined as the point during a resistant exercise set when the muscle can no longer produce sufficient force to control a given load. And data has shown that performing sets to failure with heavy resistance may activate more motor units, and in trained individuals a greater increase in muscular strength has also been shown after high intensity resistance training performed to failure compared not to failure. So literature review. Talking about the resistance training adaptations, manipulations of acute variables such as exercise selection and order, intensity, volume and duration, frequency and rest intervals cause mechanic and metabolic stress on the body. Intensity is pretty much how much or the load that is lifted, and this can be determined based off a percentage of 1 rep max, or it can also be determined using repetitions in reserve rate of perceived exertion, or RIR-RPE, which is shown to be effective. Frequency is how often an exercise is performed, and generally more frequent training produces greater strength than less frequent training, but this doesn't take into account other variables such as volume. And volume is the total amount of work done, so repetitions times weight times sets, and this has been determined to be the driving factor of skeletal muscle adaptations. Mechanisms driving strength and hypertrophy. When an individual starts a resistance training, the initial strength gains are due to neural adaptations. And after a couple months, hypertrophy is the dominant factor. Hypertrophy occurs when muscle protein synthesis is greater than protein breakdown, and during hypertrophy, the diameter of the individual fiber grows, resulting in an increase in muscle cross-sectional area. Hypertrophy due to satellite cells. So satellite cells can donate an extra nuclei to the muscle fibers, increasing the capacity to synthesize new contractile proteins. Hormones also play a role in hypertrophy, specifically IGF-1, testosterone, and growth hormone, creating an anabolic environment. And resistance training elicits hypertrophic response via mechanical tension, muscle damage, and metabolic stress. Mechanical tension can be defined as the force generation and stretch of a muscle by overloading the stimulus over time, leading to an increase in muscle mass. Muscle damage is known as the tears in the sarcolemma, which cause injury to the contractile elements of the muscle, releasing cytokines which activate the release of growth factors, regulating satellite cell proliferation and differentiation. And metabolic stress can be defined as the buildup of metabolites such as lactate, hydrogen ion, inorganic phosphate, and creatine. So training to failure. When looking at training to failure, it's a common practice, however scientific results are equivocal. Training to failure has been said to activate a greater number of motor units. Also, when an individual reaches fatigue, they progressively recruit more motor units, which provide a greater stimulus for hypertrophy, which also contribute to an increase in the metabolic stress, as mentioned before. There's also an increase in post-exercise levels and growth hormone secretion after training to failure. Greater increases in maximal strength and power with non-failure have been seen when comparing failure training to not failure training. And training to failure is not necessary for maximal increase in strength and hypertrophy in untrained individuals, while trained individuals, it may show greater increases in strength, and for trained individuals, using failure training might also be a good tool to help overcome plateaus. Looking at muscular strength in the bench press and squat between failure and non-failure groups, both saw increases in 1 rep max, but there's no significant differences between the two groups. There's also no significant differences in muscular strength and hypertrophy in failure and non-failure groups, but the group that went to failure had more total volume. So, programming periodization. Reps of 8 to 12 are typically used to failure, and sets should not be high. It should be kept around 3 sets. And training to failure should not last longer than 7 weeks, because this can lead to an increase in injury or overuse, and also lead to overtraining or a combination of them. Anything less than 4 minutes of rest will result in a decrease in execution speed, increased fatigue, and decrease in training load, and this goes against our specific goals, so it's important to have proper amount of rest time. We know that periodized training model is greater than a non-periodized, showing greater improvements in skeletal muscle adaptations. Non-linear programs have also been shown to be greater than linear, producing more muscle adaptations, and specifically, daily undulating periodization produces most desirable results in trained individuals. So the purpose and hypothesis of why we're here today is to compare the effects of a failure group and a non-failure group in daily undulating periodization scheme on muscle hypertrophy and strength in trained males over 8 weeks. And an additional aim is to compare the effects of the protocols on muscular endurance. Our hypothesis is that both groups will increase all measures of performance with similar hypertrophy between the groups, but the non-failure group will see greater increases in strength and endurance. So the methods. Subjects. We're looking to recruit at least 30 resistance-trained males, and we have inclusion criteria for these individuals. First, we are asking that they at least have 2 years of existing resistance training experience. They also should be performing the squat and bench press exercise with a minimum frequency of once a week for at least 6 months prior to the study. They also must be able to have a 1 rep max back squat of 1.25 times their body weight and a 1 repetition max for the bench press of at least their body weight. They also must be consuming a whey protein supplement for at least 6 months prior to participation. We'll go over that a little bit more later on in this presentation. So, training history questionnaire. We're going to be giving them this before engaging in the study, and each participant will complete the survey, which is going to ask about background training history. Some of the things that we're going to ask are previous resistance training experience, frequency of the squat and bench press performance, and their current estimated 1 repetition max for both the bench press and the squat. And participants must also refrain from any additional exercise throughout the study, so it doesn't have any effects on our results. Experimental protocol. Participants will be counterbalanced by absolute and relative strength into 2 groups, and will perform 8 weeks of training to either failure or not. They're going to be training 3 times a week on non-consecutive days, so for example, Monday, Wednesday, and Friday. And they'll be only performing the squat and the bench press. One group will be trained to failure, will train to volitional failure, which is essentially a point at which you cannot perform 1 rep with proper form. And one group will be training not to failure and will be asked to train within a specific RPE range of 6 to 8. Both groups will be counterbalanced to ensure no differences in absolute or relative strength using the Wilks coefficient. So participants are going to report to the lab for 25 days over 8 consecutive weeks. Each training session will take place at the same time to account for any diurnal changes in strength. Pre- and post-training testing for anthropometric measures, hypertrophy, 1 repetition max, strength, and endurance will take place 48 to 72 hours before week 1 and at the end of week 8. Participants will be given 48 to 72 hours of rest following the baseline assessments, and then they'll be given an introductory volume microcycle before starting the main training sessions. Weeks 2 to 7 are going to be the main training program, and then week 8 will consist of 2 taper sessions, followed by the post-training measurements 48 hours after the second and final taper session. So participants are also going to be ingesting branched-chain amino acids 10 minutes prior to each training sessions with 3.5 grams of leucine in it, and they'll also be having 30 grams of whey protein post-exercise training. And this is going to be delivered in powdered form and mixed with water only. And this is going to be provided due to the ability to enhance muscle protein synthesis and also to account for nutrient timing between the groups. So the testing protocol. For muscle thickness, this is going to be assessed via ultrasonography and will be used as an index of muscle hypertrophy for the chest and the quadriceps. This is going to be conducted on the right side of the body prior to 1 rep max assessment on pre and post training days. For each site, the muscle will be scanned laterally to medially with the transducer pointed perpendicular to the skin. Each site is going to be scanned twice, and the average of both values will be taken to ensure accurate measurement. And if there's a difference between the two values that is greater than 2 millimeters, then a third scan will be taken, and the two values within 2 millimeters will be averaged. While participants are standing, the chest site will be located at half the distance between the anterior axillary line and the nipple. They then will lay supine on the examination table, and here we're going to measure the lateral quadriceps mid, lateral quadriceps distal, and anterior quadriceps. The LQM and the LQD will be measured at 50% and 70% respectively of the distance from the greater trochanter to the lateral epicondyle of the femur. The AQ will be measured at 70% of the distance from the greater trochanter to the medial epicondyle of the femur. And the same investigator will palpate and scan each site of the participants. This is to ensure consistency throughout the measurements. So, 1 repetition max training testing. 1 RM strength in the back squat and bench press prior to week 1, so pre-training, and at the end of week 8, so post-training. A standardized dynamic warm-up will be given before each 1 RM test, and this will consist of various bodyweight movements lasting about 5 minutes. And the 1 rep max protocol is going to be in accordance with previous validated procedures. So Wilks coefficient is used by the USAPL and the IPF as validated method to measure relative strength. And this is going to allow for the comparison of 2 strength levels of individuals with different masses by multiplying the amount of weight lifted. And so this is either 1 rep max squat, 1 rep max bench, or total strength. And this is going to be multiplied by the standardized bodyweight coefficient. And this is going to be used to assess the changes in relative strength from pre to post training. So muscular endurance will be assessed by having participants perform as many reps possible until volitional failure. This is going to be done in both the squat and the bench press. So this is going to be measured pre and post training, 10 minutes after the 1 rep max testing for each exercise, and 60% of that 1 rep max will be used. So for example, if on pre-testing they squat 100 kilos, they're going to use 60% of that 10 minutes after, and if for post-squat they have a 120 kilo squat, we're going to use 60% of that for the muscular endurance testing. So training protocol. Training will take place 3 times a week on non-consecutive alternating days for the back squat and bench press. 5 to 7 minute rest interval will be given to ensure maximized recovery and readiness. For weeks 1, which are the intro, and week 8, which is the taper, a specific percentage will be given of 1 rep max for both groups. Okay, so here for table 1, we have the protocol for the failure group. Here we have them training Monday, Wednesday, Friday, so non-consecutive days. And weeks 2 and 3 are the same, 4 and 5 are the same, and 6 and 7 are the same. So what we have them here is doing, for example, on Monday we have 3 sets to failure at 70%. And then we're going to do that for 2 weeks. Weeks 4 and 5 will be 3 sets of failure at 72.5%. So we have them increasing percent every 2 weeks by 2.5, and each day during the week is undulated. So we have 70%, 75%, and 80%, and so on. And we're going to be recording RPE after each set. For the non-failure group, we're asking that you're going to be within an RPE range of 6 to 8. So again, weeks 2 and 3 are the same, 4 and 5 are the same, 6 and 7 are the same, but here we're actually giving them prescribed repetitions to do. So we have a 3x8 on Monday, 3x6 on Wednesday, and 3x4 on Friday to start with. And the load is going to be based off what they complete the previous week. So for example, week 1, they do their sets of squats and they give a prescribed RPE. We're going to show them what they said they could do for 8 reps in their RPE and let them choose a weight that they think will get them within the 6 to 8 RPE range. So we're going to be letting them choose, but in case they're not within the range, so for example, if they have an 8.5 RPE they say they have, we're going to be decreasing the load by 2.5 kilograms. And if they say that they have a 5 RPE, we'll be increasing the load by 5 kilograms. So every 0.5 RPE that they're away from the actual range is a 2.5 kilogram reduction or addition depending on how far they're off the range. So dietary logs, we're going to be asking participants to record nutritional intake, so all food and beverages, for 24 hours prior to each training session and to replicate their food consumption during each of these 24-hour periods to maintain normal dietary patterns throughout the study. We're also asking to discontinue any supplements and only use the ones that we give them. Again, this is to make sure that there's no influence from other supplements on strength and hypertrophy. Body fat percentage will be estimated using the average of 2 measured skin fold, and this will be obtained from the chest, abdomen, and thigh. If a measurement at any site differs by more than 2 millimeters, a third measurement will be taken, and the average of the two values within the 2 millimeters will be taken. And again, the same investigator will conduct all skin fold measurements to ensure consistency. So, statistical analysis. Students' t-tests will be used for baseline differences in relative or absolute strength and relative or absolute training volume between the groups. Pre to post training changes in 1 repetition max strength, muscle thickness, and muscular endurance are going to be performed by a 2x2 repeated measurement analysis of variance, and data will be reported as means of standard deviation with significance set at p is less than or equal to 0.05. Pre to post training percentage change values will be calculated as follows. We're going to have post-test value minus pre-test value divided by the pre-testing value times 100. And for pre to post training effect size, for each strength and muscular thickness measure in each group, it's going to be calculated by post-testing mean minus pre-testing mean divided by the mean of the standard deviations. And the magnitude effects will be in accordance with Cohen. So limitations and practical implications of this. Some limitations, we're going to have a relatively small sample size if we end up getting 30 or plus or minus. Still relatively small, and we're only going to be looking at trained males, so we can't say that the findings here are going to be applicable to females. Also, the people coming into the study may not be familiar with the RPE scale, so they may record RPE that's not accurate, so saying things are more difficult than they actually are, or less difficult, which could have an influence on the results. Also, some participants might be unfamiliar with reaching actual failure. They might mentally think that they can't do more when they actually can, or vice versa, they say they can do more when they actually can't. So this again might affect the data. So for practical implications, we're saying that we could want to see if there's any proper way to use failure training to maximize results while also minimizing the risk for injury. So this, whether it be to break a plateau, to switch things up, or just to mentally help people get over something that, they think they might not be able to hit a specific 1 rep max, but they see that training to failure can give them that confidence. We want to see if there's any implications for that and to see how to properly apply failure training. And as always, thank you for your time and for listening, and really appreciate it. Thank you.